Next, from the state capitol, Howard Peters, Executive Vice President of the Illinois Hospital Association, talks to us about the proposed reforms to the Illinois workers' compensation and the impact this might have on hospitals across the state. We'll also hear from Dr. David Fletcher. This runs about 10 minutes. 2-1. Howard Peters, Executive Vice President of the Illinois Hospital Association. Thanks for joining us.
Glad to do it.
We're here on the last day of the lame duck. Tomorrow, the new legislature comes in. There are a lot of major issues on the table. One of them is workman's comp. I know you have some thoughts on what that would mean to hospitals, and we'd like to hear your thoughts.
Well, remember that hospitals are, in addition to providing health care for injured workers to help restore them, hospitals are also large employers. Across the state, we employ about 250,000 people. So we care about this issue both on the business side and on the provider side. Our concern at the moment is that we're rushing at the last minute to get something done, and we think that this issue is so complex that it ought to be a thoughtful dialogue between all of the parties to make sure that, again, injured workers are properly cared for, and so that's something that's fair to injured workers but not unfair to business, and we're just concerned about how fast things are moving.
I have heard a number, and I can't even tell you where necessarily it comes from, that if this were to pass, it would cost hospitals across the state in the area of $100 million. Can you comment on that? And if it would cost the hospitals money, in what ways would it cost them?
Actually, some of the proposals that are out there could cost hospitals more than $100 million, which we think is flawed. And the way that happens is, 5 years ago, Illinois agreed on a fee schedule for hospitals and doctors to reduce the cost. So hospitals can only collect based on a fee schedule and not based on what they actually would charge for that service. In addition to that, businesses are able to come to hospitals and negotiate an even lower rate. We think that's the way things ought to work. What's being considered is to reduce the fee schedule by another 50% and to eliminate something called geo-zips. At the moment, the fee schedule is based on comparing apples to apples, hospitals located in the same community, like Springfield. Some of the proposals would say, let's compare hospitals in Springfield to hospitals in Cairo or hospitals in Waukegan. We think, again, that's flawed. You ought to be basing the payments based on hospitals that are similarly situated. And just one other thing, imagine the difference between Memorial Hospital or St. John's Hospital, that are major teaching hospitals, with the critical access hospital in Lincoln. The people they serve are very different. The kinds of complexity of care is different. You shouldn't have a charge structure that lumps them together. So we're concerned about reducing the geographical areas, and we're concerned about across-the-board cuts in the fee schedule, because that can make a difference in terms of the quality of care and the access of care to injured workers. Yes, we believe the state should do some things to reduce the cost of workers' compensation, but not at the expense of injured workers not getting the best care available.
One of the things that came up in committee, and I don't know if it's in the bill at this point or not, but was that there could be a consultation with a doctor outside the state of Illinois. Can you address that issue?
Yes, that's the issue with regard to what's called utilization review. So an injured worker goes to a doctor for care, or it requires emergency care in a hospital. And the doctor and that patient decide what's the best course of treatment. On an after-the-fact basis, that person's file may be sent to a doctor out of state who's never seen the patient, never examined the patient, and may not be a member of the specialty of the service that patient needed, who then gets to decide whether or not the care that the patient got was necessary and should be paid for. Again, we think that's unfair. We want utilization review to be by qualified physicians in the practice area that the person needed the service. You wouldn't want an eye doctor telling your cardiologist what course of treatment you needed for a heart condition. Well, this is analogous to that. Someone out of state who's never seen the patient making a decision about what the patient needs.
And you already alluded to this. I mean, of course, all the business groups are like saying one of the primary impediments of bringing new business in to the state of Illinois is the cost of medical malpractice, that it's just too high here. And you, as you mentioned, you're also employers, so that's costing the hospitals. Why? Can you explain to the layman that are watching this, why is medical malpractice, or not medical, I'm sorry, workers' compensation higher here in Illinois than in other states?
See, it's interesting that you had a slip of the tongue and said medical malpractice. One of the reasons that workers' comp maybe costs more in Illinois is because of medical liability. Medical liability in Illinois is one of the worst states in the country for medical liability. When you think about what our doctors pay for medical liability coverage, some hospitals can't buy medical liability coverage. They have to self-insure. That drives up the cost. Illinois is also a high-wage state. You know, what we pay, nurses and other workers in hospitals and in healthcare also may be higher than in some other states. So all of that comes to play in terms of what the cost of a good or service is. Think about, there is no business in this state would want the government deciding how much should they charge, whether that's for a loaf of bread or whether that's some sophisticated health life-saving equipment that they manufacture. So it's unfair for those same businesses to say to government, we don't want you to control our prices, but we want you to say how much a doctor can charge or how much a hospital can charge. They should come and negotiate those costs, those prices, just as they go and negotiate with their suppliers for goods and services that they want to buy.
One last question. When you're talking to lawmakers and trying to educate them on the issues, I'm just kind of curious to educate the viewers a little bit. How do you handle when you have issues like this that are so complex? There's so many different layers to them. You go in and talk to a lawmaker, often they're going to say, make your point in 30 seconds. What is the challenge for someone in your position to educate the lawmakers who may be coming from a background in accounting or farming?
I want them to get two things. One is the Workers' Compensation Commission, which should have some objectivity in this, says of the medical fee schedule, the medical fee schedule is in fact reducing the cost of medical services in the state. It's only fully been implemented in the last 6 months. Let it run its course. It'll continue to drive down costs. And the other thing that I say to them is, remember, hospitals are also major employers. In some counties across the state, they're the largest employer in the county. Don't do things to adversely affect those big employers. Together they employ 250,000 people.
All right. Well, Howard Peters of the Illinois Hospital Association, thanks again for joining us.
Thank you very much.
Thanks, I appreciate it. What's your response to what you heard in the committee hearing?
Well, I'm disappointed. I believe this bill has gone way too fast. I definitely believe there needs to be work comp reform, which I've championed for a long time. But I don't believe that the medical community has had a voice or a seat at the table to give our input. After all, it's people like myself who are on the front line of taking care of injured workers. And I want to be the voice for the injured worker. And what I'm hearing right now concerns me is going to be to the detriment of our injured workforce.
And what reforms specifically would you like to see? Tell us a little bit from your perspective, what are the problems with the current system?
Well, the current system is just very difficult to sometimes get approval for necessary treatment. A lot of delay, and now they've added additional language regarding utilization review, which has been very problematic for me as a doctor, and my experience with that has been another delay tactic to not approve and pay for treatment. Consequently, patients get delay in the necessary treatment they need. The second aspect is not enough focus on prevention. Employers can save money by stopping work injuries in the first place. There's no language in this bill that provides funding, training, emphasis on prevention, and I really believe that's where it misses the mark.
You're watching the Illinois Channel, an independent nonprofit corporation formed to provide gavel-to-gavel coverage of Illinois state government and other public affairs events taking place across Illinois.